Hello everyone, I'm Professor Lee of Dr. Wild Love TV. Finally, today is the last lecture day. In addition to the top 11 introduced so far, there are more important herbs diabetes improvement effect has been proven in clinical studies. For example, as you can see in this slide, Amna, Ferroveris aristata, olive leaf, Silybum marianum, Ocimum tetriflorum, also known as holy basil, Jerusalem artichoke, also called pork potato in Korea. There are many people who eat it in Korea. Punica granatum, also known as pomegranate, Nigella sativa, is black cumin seed, etc. If none of the top 11 are what you want, but if you want any of these herbs you see, and there are herbs that suit your taste, choose one of these. It is not bad. Here are top 11 important anti-diabetic herbs introduced so far, but not in the top 11 because of the lack of clinical studies. There will be a plant which have excellent diabetes improvement effect, and those plants someday proven by clinical studies, and it will be known to us. Then you can use it. Despite the lack of clinical evidence, there is no need to take such a plants beforehand. The plants belong to the top 11, something qualified you can trust, so it is best to use this first, Top 11 plants are very valuable plants. Please take a look again. Well, the most important last lecture, let's begin. 4 important things to talk about today. 1. Among the top 11 plants, how to choose the herb that's best for you. 2. I'm going to tell you how to determine your daily dose. This is very important. Disadvantages of medicinal plants are each product is different content of active ingredient. Also, when taking in many cases, inconsistent doses are taken. It's not very good. The inconsistency of medicinal plant content, the only way I can make up, it is always measure and take a certain amount. You can decide what works best for you. Therefore, I'll tell you about how to adjust the herbal dose. When determining the dosage, sometimes it is good to mix 2 herbs together. So I'm going to tell you how to use the 2 herbs. 3. Among the method of taking herbs, when taking herbal tea, I'll explain it through a practice video. 4. Finally, once you start taking herbs, how to adjust dosage, how to find the dose that works best for you, and I'll tell you how to find a dose that you can take a long time. First, how to find the herb that's best for you. Among diabetic patients, there are a lot of people who have hyperlipidemia. How to choose the right herb for you is very easy. Because all herbs belong to the top 11, diabetes as well as hyperlipidemia improvement effect are proven by clinical studies. So, you may choose any of these. It has an improvement effect on both diabetes and hyperlipidemia. At this time, consider only next 3 things. 1. If there is a herb you want, just select it. 2. Herbs that are easy to obtain are good. Where you live now is all different, so in the area where you live, it is good to choose herbs that are easy to get. 3. Herbs that suit your taste would be good, right? Selecting herbs and taking for a few months, diabetes and hyperlipidemia improvement will be seen. Next, if you also have high blood pressure, there are a lot of diabetic patients like this. Herbs that can improve diabetes, hyperlipidemia, and hypertension, there are 5 of them: cinnamon, fenugreek, bitter melon, garlic, and gymnema. You can choose one from these 5 options. If obesity is your concern, aloe or gymnema are good. In addition to diabetes and hyperlipidemia, those who have cardiovascular disease or peripheral vascular disease, arteriosclerosis related problems, you can choose garlic or ginkgo leaves. If your stomach function is not good, for example, indigestion, frequent abdominal pain, and loose stools, etc., ginger, cinnamon, aloe is a good choice because it improves diabetes and hyperlipidemia, and it also improves gastrointestinal functions. Problems with sexual function in men, for example, erection problems, decreased libido, or a woman with menopausal symptoms, you can choose fenugreek or ginseng. Those who are diagnosed with diabetic retinal complications, ginkgo leaf is good. If you are worried about memory loss or cognitive function problems, you can choose ginkgo leaves or ginseng. If you want to increase muscle strength or endurance, you can choose fenugreek or ginseng. In other words, if you take fenugreek or ginseng regularly, strength and endurance may also improve in addition to diabetes and hyperlipidemia. Next, there are many people who have osteoarthritis of the knee. Alone have strong anti-inflammatory action. Turmeric and bitter alone have been clinically reported to improve arthritis. So it is a good choice for arthritis. Function, turmeric is good. Finally, not type 2 diabetes, people with type 1 diabetes. Gymnema reduced the need for insulin injections. Let's talking about how to determine your daily dose. If only one herb is used, tablets, capsules, or powder products made from the herbal extract, just buy it and use it. Read carefully the recommended dosage. Start with the lowest recommended amount. When choosing herbs to drink, the main problems are diabetes and hyperlipidemia. If there are no other health problems, only one herb can be used. By the way, the herbs belonging to the top 11 are all of them work. On the slide you are looking at, the daily dose is indicated from the smallest amount to the largest amount. Of course, depending on the person, there are cases where a large amount is needed. This slide shows generally recommended dose for each herb. You can start with the smallest amount of these. In addition to diabetes and hyperlipidemia, if you have other health problems, using 2 herbs is better than single herb. In this case, if you take it as a tablet, capsule, or powder, you must use 2 or more capsules. Most diabetic patients take a lot of other prescription drugs. If you take multiple herbal capsules, it becomes a burden. 2 herbs as a herbal tea. From now on, I'll tell you how to make herbal decoction tea. Ingredient of herbal tea are dry leaves, fruits or seeds, branches, root. First, it's important to keep your dose constant on a daily basis. Therefore, the weight must be measured with an electronic scale. Electronic scales can be purchased at stationery stores or on the internet. You always take a constant amount to find the dose best for you. If you took 5 grams today and 7 to 8 grams tomorrow, you cannot find the dose best for you. The use of medicinal plants should be considered a medicine. About 1 liter of mineral water daily. Decoct leaves or fruits for about 15 minutes. Then active ingredients are extracted. The seeds are harder than leaf, so 30 minutes is good. Roots and branches should be decocted for about 100 minutes. Then it becomes herbal tea, and you can take it like tea 2 to 3 times a day before or after meals. What you see now, among the type of cinnamon, I purchased Ceylon cinnamon. It's a stick product. I'll take 1 and weigh it one cinnamon stick on the electronic scales, the weight is 4 grams. These are the fenugreek seeds I bought. Stir fry without burning, it tastes better. Roasting now. Is it well stir fried? I'll weigh the fenugreek. First, I weigh the paper cup on an electronic scale. The paper cup weighs 2 grams. Add 1 teaspoon of fenugreek seeds. The weight of 1 teaspoon, the light one is 1 gram and the heavy one is about 2 grams. Since it is a seed, it's about 2 grams. 2 spoons of seeds, it weighs 6 grams. Subtract 2 grams of paper cup weight from 6 grams is 4 grams. 4 grams of fenugreek seeds is a good starting dose. From now on, to make herbal tea as a starting dose, 4 grams of cinnamon and 4 grams of fenugreek seeds. I put it in a brass net. What you see is a decoction teapot. In 1 liter of mineral water, put the brass net containing the cinnamon and fenugreek seed. Cinnamon is a bark of a tree. Decoct for about 100 minutes. Set the timer on the teapot to 100 minutes. Now 100 minutes have passed. This is the daily amount of cinnamon fenugreek herbal tea. You can decoct the leftover herbal remnants 2 or 3 times more. However, herbal tea made by herbal remnants, the amount of extracted active ingredient much less than the first one. So you should throw in the trash. Or you can use it for food or use it while cooking. Shall I pour herbal tea into a cup? Oh, the fragrance is very good. The scent of cinnamon and fenugreek seeds mixed is very good. The leftover herbal tea, it can be kept indoors in a warm state, but because it spoils in summer, it's better to put it directly in the refrigerator. So you can take it whenever you need. Well, should I try herbal tea? This cinnamon fenugreek herbal tea is just for you. What are the effects of this herbal tea? You've been studying hard so far, so you know what the effect is. Diabetes and hyperlipidemia will improve. Since it contains cinnamon, it will be good for gastrointestinal problems. Fenugreek seeds helps man's sexual function and female menopausal symptoms. You will also see good changes in your strength and endurance. Wow, awesome, right? If you drink herbal tea every day, 5 to 6 health problems all get better. From now on, let's talking about how to determine the amount of herbal tea for long-term taking. First of all, you should observe the side effects and therapeutic effects, right? The dosage show improvement with no side effects. It is just the dose for you. The side effects of herbs are rarely serious. Do you know the side effects of prescription diabetes drug? There are 2 most commonly prescribed drugs. First, let's see metformin side effects. Gastrointestinal problems such as abdominal pain and diarrhea are common. In addition, hypoglycemia, altered taste sense, vitamin B12 deficiency, low blood pressure, shortness of breath, etc. The drug sitagliptin, gastrointestinal problems such as vomiting, diarrhea, and abdominal pain. In addition, hypoglycemia, allergy, shock, angioedema, headache, liver dysfunction, pancreatitis, etc. Compared to these side effects of prescribed drugs, the side effects of medicinal plants are really mild. Diabetic medication side effects are not bad because its pharmacologic action is powerful. While the treatment effect is good, there are side effects. However, medicinal plant is not a single concentrate extract. You don't need to worry too much. From now on, let me tell you how to determine the dose for long-term use. 1. Always start with the lowest dose. When using two herbs, the starting dose is the sum of the lowest dose of each. This is used after weighing on an electronic scale. Take it for 2 weeks. 2. Observe side effects for 2 weeks. Take it for additional 2 weeks. So that's a total of 4 weeks. In the case the effects appears quickly, diabetic improvement can be seen from 4 weeks. You need to check your blood sugar. No side effects after 4 weeks. Then there is a blood sugar lowering effect. This is a very lucky case. You can maintain this dose and take it for a long period of time. On the other hand, if there is no improvement in diabetes, take the same dose for 4 more weeks. And at week 8, measure your blood sugar. Even at this time, if there is no improvement in diabetes, it's better to increase the dose a little. When increasing the dose, it's not about doubling or tripling. You can increase it by about 0.5 times. For example, you can use 3 to 12 grams of cinnamon per day. We start with 3 grams, and after 4 weeks, there are no side effects, but if there is no effect yet, so continue to take as 3 grams for 4 more weeks. If there is no improvement in diabetes after 8 weeks, increase the daily amount of cinnamon from 3 grams to 4.5 grams. For another example, bitter melon, we can use it 6 to 15 grams. We start with 6 grams and take it for 8 weeks. If there is no improvement in diabetes, increase 6 grams to 9 grams. Try using 9 grams for 4 more weeks. When adjust the dose, it is to adjust within the maximum dose range, and a satisfactory effect is appeared, you can keep it at that dose. Finally, the whole lecture up to here is over. Everyone, thank you so much for your hard work. Did I work hard too? Let's all clap in praise. Everyone, thank you for your hard work. The next lecture is hyperlipidemia. Antidiabetic herbs belonging to the top 11. All of them have an improvement effect on hyperlipidemia. However, if we focus on hyperlipidemia, different herbs from the top 11 are included. So new herbs that are good for hyperlipidemia, I will prepare hard for hyperlipidemia lecture. Everyone stay healthy and have a great thing.